Consortium and Cancer Pathways. I'd like to welcome everyone to the 9th Annual Georgia Cervical Cancer Awareness Day event, where all of our groups have come together. But this awareness event actually started 11 years ago by Triana Arnold-James. And I can't help be struck by the symbolism of that timeline. HPV vaccination is recommended for all young people at 11 years of age, but it can be started at 9 years of age. So regardless of what way we look at it and what timeline we're looking at, this event is now eligible to get its first dose of HPV vaccine. So I think we can all. So I'm Dr. Robert Bednarchuk. Many of you probably know me as Dr. Bob. I'm a faculty member at the Emory University Rollins School of Public Health. I'm also the Associate Director for Vaccine Policy at the Emory Vaccine Center and a faculty member in the Cancer Control Program at the Winship Cancer Institute. I'll be your Master of Ceremonies for today. I want to start off, I want to thank everyone who's here today. It's so great to see so many familiar faces. We do a lot of Zoom calls. There's a lot of people that we see in those settings, but then there's also a lot of people that I see once a year at this event. So I see some familiar faces here. I see a lot of familiar faces, but I also see a lot of new faces. And that makes me so happy to see this room filled up, to see so many people here that are coming together, all because we're committed to the prevention of HPV-related cancers, including our focus today, which is cervical cancer prevention. It's great to see our legislative staff here. Some of our legislators, Representative Evans and Senator Rhett, are tied up with the state of the state right now, but their staff are here. It's really great to have that linkage, to have these representation from our lawmakers here to hear about what's going on, not just to present this year's resolution around Cervical Cancer Awareness Day event, but to have a chance to interact with all of us, our community partners, our researchers, our healthcare professionals, our vaccination advocates, to learn more about why we're doing this important work and to see if there's ways that we can all work together to try to prevent these cancers. I'd also like to take a moment to thank the planning committee for this event. That group that was led by Triana Arnold-James also includes Dr. Amy Baldwin, Dr. Ashley Hannings-Chinchilla, Bella Borghi, Samantha Wells, Sarah Bilbro-Williams, Dr. Ryan Suk, Allison Agnew, Valine Petit, Astrid Wilkie-McKellar, Jana Master-Giovanni, Rana Bayakli, and Nairi Riley. So there's a large team that came together to get this event to go off without a hitch today. So just a quick round of applause and thank you for everybody who made it possible. So right now, this is a time of unprecedented challenges in the world of public health and prevention, especially when it comes to vaccinations. As we all know, HPV vaccine uptake remains lower than we need it to be to reach our goal of elimination of cervical cancer. But we're also seeing declines in vaccine coverage across the board. The US right now is experiencing its worst measles outbreak in over 3 decades. We're currently seeing one of the largest whooping cough outbreaks across the country that we've seen in years. So really, this effort, we're focused on cervical cancer today. We're focused on HPV vaccine, but that sits within a system. It sits within a system of vaccines that we all need to be advocates for, because the best thing that we can do is to have that level of prevention. But even with all of that, we're all here today. We all believe in this work so much that we've taken time out of our busy days to come here in community so that we can recognize the work that's been done, but also get energized to keep going and moving forward. So I want to thank all of you for that commitment, the commitment of your time, the commitment of your efforts and your energy that has gone into all this important. Now, speaking of recognizing good work, I would like to introduce our first speakers. Again, as I mentioned, Representative Evans and Senator Rhett are tied up right now, but I would like to welcome their staff members to come up to present this year's resolution recognition for the 2026 Cervical Cancer Awareness Month from the Georgia Legislature. Representative Evans and Senator Rhett have been very strong advocates for public health. We've seen them come to this event in the past, and their presence is something that we keep looking towards. And it's wonderful to have that representation here. So I would invite you to come up and present the resolution.
We have Elijah from Representative Evans' office. and then followed by Xavier from Senator Rett's office. And the reason I just wanted to say real quick, the reason why these resolution bills are so important, and I try to kill two birds with one stone, so I can get the information out to the masses. So Elijah is on the House side, and Xavier is on the Senate side. And so it's basically the same information. So when crossover day comes, I can come down on crossover day, because the bills, what that means is the bills crossover. I can, it gives me leverage to ask for a committee hearing, because I can say, well, the House has it and the Senate has it, so why not? So that's why I do it that way. And I appreciate Representative Evans. She's an amazing person, one of the first person that I sat down with 11 years ago. I've known her longer than that, but 11 years ago when Susan passed. And she's just said, hey, you need to come down here. You need to talk to other legislators, and we need to get this done. And then Senator Redd, he always sponsors the Equal Rights Amendment bill that help us to, hey, women be in the Constitution. As you all, I don't know if you all know that or not, but we're, as women, our only guaranteed constitutional right is our right to vote. That's it. That's our only constitutional right. So we work with Senator Redd to ensure that the women have more than just the right to vote here in the state of Georgia. So without further ado, Elijah's gonna come up and present and read the resolution, and then followed by Alexander. It's my son, Xavier.
That was a great legislative lesson for everybody. So, like she said, my name is Elijah Johnson. I am Chief of Staff to Representative Evans, and she is caught up in the state of the state at the moment, but she will come by. But until then, you have me. So I'm just going to read this. So we've got House Resolution 1012 by Representative Evans of the 57th, Representative Sanchez of the 42nd, Representative Howe of the 50th, Representative Roberts of the 52nd, and Representative Clark of the 108th. A resolution recommending and commending the Susan Jolley Foundation, the Georgia Cancer Control Consortium, a program of the Georgia Department of Public Health in cancer pathways for the supplementary contributions to cervical cancer education and awareness in Georgia and for other purposes. Whereas January is designated by the United States Congress as Cervical Cancer Awareness Month, and whereas the Susan Jolley Foundation, the Georgia Cancer Control Consortium, HPV CancerFree Georgia, and Cancer Pathways are steadfastly committed to advancing HPV awareness and cervical cancer elimination, prevention, screening, and education throughout Georgia. And whereas, in recognition of the impactful work, Sharon J. Hill and Demetrius Geiger are hereby honored as the 2026 HPV Community Champions. And whereas 26.5%, slightly below the national median of 77.7%, leaving approximately 1 in 5 women unscreened. And whereas significant geographical disparities exist within Georgia, including Forsyth, McIntosh, Towns, and Franklin counties, reporting cervical cancer screening rates lower than 60%, underscoring the inequities in access and outreach. And whereas, as of 2023, 63% of Georgia adolescents ages 13 to 17 are up to date on HPV vaccination series, below the Healthy People 2030 rate of 80%, and lagging behind the United States average of 77% for at least one dose. And whereas, in Georgia, an estimated 327 new cases of cervical cancer are diagnosed annually, with approximately 204 deaths due to disease each year. And whereas cervical cancer is most frequently diagnosed in the 35 to 44 age group, the average United States age at diagnosis is about 50, and nearly 20% of cases occur after age 65. While many guidelines permit cessation of screening after 65 in individuals with a long history of normal results. Those lacking such history should continue appropriate surveillance. And whereas, as of recent data, 82 of Georgia's 159 counties have no OBGYN provider, and 15 counties have only one OBGYN, thereby limiting access to reproductive health and screening services. And whereas Black and Hispanic women in Georgia experience disproportionately higher incidence and mortality for HPV-associated cervical cancer, reflecting persistent racial and ethnic disparities. That's what we have.
Good morning, everybody. How are we doing today?
Okay.
My name is Xavier Means. I will be joining everybody today on behalf of Senator Rhett, who regrettably cannot join us as he is recovering from the flu. So it is my honor and privilege to stand here in his place. I want to say thank you to Elijah for that wonderful recitation of the resolution that we have been working on. Some great facts in that resolution, and it's important that we bring awareness, and that's why we're all gathered here today. Today, I join you not just as a representation of my legislator and his office, but as a partner, community member, and advocate in a mission that transcends politics, the mission to prevent cancer and save lives. Please allow me to extend my deep gratitude to the elected officials and the organizations that have made today possible. To Representative Evans of District 57, thank you for your leadership and your partnership in championing women's health and preventative care under this gold dome. Your commitment is essential. To the medical experts who join us today, Dr. Casey Daniel from the University of South Alabama College of Medicine and Dr. Teresa Chappell from the Augusta University Medical Partnership, we are so grateful for your expertise, your frontline work, and for bringing the voice of science and medicine directly to our policymakers and to the public. This event is a powerful testament to collaboration. We see it all around us in the logos and the signage and the data. The medical partnership of the University of Georgia, a cornerstone of education in our state, the Emory Winship Cancer Institute, a beacon of world-class research, treatment, and hope, and the vital continuing education providers that ensure our healthcare professionals have the latest knowledge to serve our communities. To the healthcare workers, advocates, survivors, students, and concerned citizens here today, thank you. You are the driving force behind our gathering. Your presence amplifies this message. We are here for a very specific and urgent reason: cervical cancer awareness. In our world of modern medicine, cervical cancer stands out in a profound way, and that is an overwhelmingly preventable disease. We have the tools, we have the science, we have a clear path forward. We have the HPV vaccine, which is a powerful shield that can prevent the vast majority of these cancers before they even have a chance to begin. We have regular screening, the PAP test, and the HPV test, which serve to detect precancerous changes early when they're the easiest to treat, effectively stopping cancer in its tracks. We have these remarkable tools, and so it begs the question, why are we still here? The answer lies in the gap between what we know and what we do, the gap between availability and access, and the gap between the awareness and the action. Our work today is about closing those gaps. It's about ensuring that every parent, guardian has the information and the access to protect their children through vaccination. It's about ensuring that every woman, regardless of her zip code, her income or affordability, or her insurance status, can get the life-saving screening she needs without fear of financial ruin. It's about confronting the stigmas, dismantling the barriers, and having conversations that empower people to take charge of their health. Senator Rhett sees this as a core issue of equity, of economic stability, and of simple justice. Preventable cancer is a burden no family should bear. Lost lives to a disease we can stop is an unacceptable tragedy. The discussion we have today, led by our doctors, informed by our institutions, and pushed forward by our voices, are not just conversations. They inform the policies we craft, the funding we allocate, and the partnerships that we decide to strengthen. Over the next few hours, I urge you to listen and to engage. Ask the tough questions, share your stories, connect with the resources that are here today. Let us not leave here just more aware, but more resolved. Resolved to advocate for broader vaccine access. Resolved to support funding for screening programs. Resolved to be a voice in our own communities that dispel myths and spread facts. Together with our medical partners, our legislative champions, and the unwavering force of this community, we can make the phrase cervical cancer not one of fear, but of triumph, one of a testament to what happens when prevention, policy, and people align. I want to thank everybody again for being here, and thank you for your commitment to this cause.
Teach these young people. Okay. Yeah.
Just a moment. Gotcha.
Thank you.
Thank you.
Yeah. Dr. Bob is on.
Thank you so much, Elijah and Xavier, for being here to speak on behalf of Representative Evans and Senator Rett, and thank them for all their continued work to support the efforts that we're doing to try to prevent HPV-related cancers as we continue to move towards our ultimate goal of the elimination of cervical cancer as a public health problem. So that sounds like a mouthful. Elimination of cervical cancer is a public health problem. But in that context, it is a goal that we can reach. It's a goal that we can work towards. And it's something that many of us have been working towards. So in that vein now, I would like to introduce our keynote speaker, my colleague and friend, Dr. Casey Daniel. Dr. Daniel is the Director of Epidemiology and Public Health, an associate professor at the University of South Alabama, Wooden College of Medicine, and the University of South Alabama Mitchell Cancer Institute in Mobile, Alabama. I started working with Dr. Daniel a few years ago. We're both members of the HPV Vaccination Roundtable of the Southeast. This is a consortium of folks that are working in this space from 14 states and territories in the Southeast US, where we see the lowest HPV vaccine uptake and the highest cervical cancer rates across the country. This group has come together and decided that one of their priority actions was to help support cervical cancer elimination planning. Dr. Daniel has led the work group on behalf of that work for the Roundtable of the Southeast, which recently has released its toolkit to help states develop their own cervical cancer elimination plan. This is some work that I've been working very closely with. But again, Dr. Daniel has led that elimination working group. She's going to talk about her work and what's come out of that and how we can all work together to reach that goal of the elimination of cervical cancer. So Dr. Daniel.
In the light. With the light.
Oh, yeah.
Can you see this?
That's better. Yeah.
Thank you for that very nice introduction. Unfortunately, the wonderful people who've gone ahead of me have kind of stolen my thunder. I don't know that I have much new to tell you, but I will do my best. So thank you for that kind introduction. I'm Dr. Casey Daniel, and I am housed at the University of South Alabama, our College of Medicine, and our Mitchell Cancer Institute there. And I have the pleasure of working with Dr. Bob at on the Southeastern Roundtable and leading the elimination policy work group, as he said. And just to get everything out there, I don't have anything to disclose. So likely everyone here is familiar with HPV, but just as a very brief overview, human papillomavirus, or HPV, is the most common sexually transmitted infection in the world. It's more common than the common cold, and almost everyone will be infected with HPV in their lifetime. There are currently 80 million adults in the US infected with HPV and an estimated 42 million new infections each year. Another quick overview. There are over 200 strains of HPV, and high-risk strains can cause 6 different cancers in men and women. This graphic shows those 6 cancers, which are oropharyngeal or throat cancer, penile, vulvar, anal, vaginal, and what we're most concerned with today, cervical. Cervical cancer is the most common HPV cancer in women, and Dr. Chappell will talk more about this disease risk beyond just cancer specifically in a bit. So I won't steal her thunder. There are almost 40,000 HPV cancers diagnosed every year in the US, which means that someone is diagnosed with HPV cancer every 20 minutes. Since our focus is cervical cancer, I want to emphasize, or maybe make some of you aware, that the Southeast US, well, I won't make you aware because I've already told you. The Southeast US has much higher rates of cervical cancer compared to the rest of the country. This map shows rates of cervical cancer by state. And this is from years 2017 to 2021, which is the most recent data available right now. And you can see all of that red and orange in the Southeast pretty exclusively almost. The state of Georgia has the 15th highest rate of cervical cancer in the US and the 9th highest rate of death from cervical cancer. So there's definitely some work to be done here. But just as a reference, Alabama, where I am from, is 6th in rates of cancer and cervical cancer and 3rd in death. So, and that's an improvement. Next. But there's good news. So one of the most significant ways that we can impact those rates of cervical cancer is through prevention through the HPV vaccine. And this is highly effective. We know this. The HPV vaccine prevents against more than 90% of HPV-related cancers. And the 3 main points we always emphasize about the vaccine, because they're absolutely accurate, are that the vaccine is safe. And that it's effective and that it provides long-lasting protection. And we know this from decades of research on tens of thousands of individuals all over the world. I actually just recently found this graphic and was surprised that it's not past me for so long. Because I think it's really interesting. This is an HPV vaccine timeline put together by the American Association for Cancer Research. And I just want to hit on some of the most relevant points for today. This is a tricky one there. So 2006 is when the first HPV vaccine, Gardasil 4, was approved for females aged 9 through 26 in the US. 2014 was the introduction and approval of Gardasil 9, which protects against 9 different types of HPV and supplanted Gardasil 4 in the US. I can tell, I can be different. Leave feedback. Okay, and then in 2020, the World Health Organization, or WHO, they launched their strategy for worldwide cervical cancer elimination, which I'll talk about. And then 2030 is a significant target date for meeting the WHO vaccination screening and treatment guidelines, which we'll also talk about. And then 2070, that's when it's projected to see an 88.9% reduction in cervical cancer mortality if the WHO's initiative goals were met. But I did want to point out a couple of things that I was surprised were left off of this timeline, and that is first, that hard one, 2009, that's when Gardasil 4 was approved for males aged 9 through 26. And then 2011 And that's when CDC added HPV vaccination as part of routine recommendations for males age 11 to 12. And these are significant dates because there are still an alarming number of people who don't realize that males can and should be vaccinated against HPV. So I wanted to include this slide because everyone loves a nice graphic. And this is a very nice depiction showing that HPV vaccination works. So on the left, the axis going up, if you will, that shows the cumulative incidence of cervical cancer for 100,000. And this is in Sweden, by the way. And without even looking at anything else of the other axis at all, that's showing the age at the bottom there, you can see that that orange line is showing unvaccinated individuals, and the blue and green are showing vaccinated individuals. And right off, you can see that the unvaccinated persons have much higher cervical cancer incidence compared to the two groups that have been vaccinated. So you can just not knowing anything else, you can see that the unvaccinated much higher rates of cervical cancer. Then looking closer, you can see that the green shows that those who are actually vaccinated younger than 17 years old, and that's the green. And the blue is for those who are vaccinated between 17 and 30 years old. So there's clearly a significantly lower rate of cervical cancer for those who are vaccinated in the younger group, so under 17, even compared to those who are vaccinated in 17 to 30 range. So basically, the younger vaccinated, the greater protection that they receive. And there are many more studies that are supporting these findings from other countries like Scotland, Finland, Norway, and a lot of other countries as well. Here we have data from the National Immunization Survey Team, NIS team, which is an annual survey from CDC. And it is an annual survey that is nationally representative of U.S. adolescents ages 13 to 17. And in the table, you can see where Georgia stands, right there at the top, and how it compares to the other southeastern states, it actually is among the best among the southeastern states. Virginia is an exception, but they have a state requirement, so we can't use them really as a comparison. But there's still a public health gap because, the Healthy People 2030 goal is 80% up to date. This is, again, for up to date vaccination, not just for any vaccination. And the other state level highlights, national up to date coverage is 62.9%. So actually, Georgia's higher than the national rate, which is fantastic. And the range, we've got Rhode Island, which is also it's required there, is 76.1%, and Mississippi always ran up the rear with 39.1%. So I did want to note, though, something that since Dr. Rob mentioned that we are struggling with declining vaccination rates, that while this 76.1% in Rhode Island is great, impressive, that's actually down from 2023 when it was 84.2%. So it's a pretty significant drop. And this is very colorful. So this is the estimated vaccination coverage among adolescents 13 to 17 years old by year. And this goes from 2008 to 2022. And you can see here, if you look at the colors, so HPV is going to be in your orange and in your green. And you can see that HPV vaccination lags these other routinely recommended vaccines for children of the same ages. And that's shown by this first arrow here at the end. I really do need a long. Yeah, so why is there a difference? Tdap and meningococcal, for now, success is driven strongly by school entry requirements and provider recommendations. HPV vaccination, despite preventing multiple cancers, it lacks the same structural drivers. So there's this gap between adherence. the takeaway is that, most teens are fully protected against tetanus, pertussis, and meningococcal disease, and far fewer are protected against HPV cancers. And closing this vaccination gap is a critical national health, public health priority. But actually, there's another gap here too, and that's between HPV vaccination initiation and completion. So that's that second arrow at the end. So that is where you see, how many have initiated and how many have completed the series. And that's another issue that we need to deal with, hopefully. Trying to stay on top. Okay, next. Okay, sorry, it's another Jamie got this.
I can already tell.
All right, so. Okay, it's in cervical cancer. It's not just about prevention, it's about elimination. So, yeah, we're good. It's important to distinguish between elimination and eradication. These are two markedly different concepts, and they are not interchangeable terms. So elimination does not mean the complete absence of disease. That's important to remember. Elimination indicates potential to significantly lower the burden of HPV-related disease. Here we're talking specifically about cervical cancer. And the WHO defines elimination as an incidence rate of less than 4 cases of cervical cancer per 100,000 women. So we're not saying that it's going to be completely gone, 0 cases, never again. We're being realistic. We're trying to reach an attainable goal. And okay, so again, not just prevention, but elimination. Yes, this is so. So elimination is very possible. And that's because cervical cancer is one of the most preventable cancers there is. And that's because almost all cases are caused by HPV, over 90% of cases. And we can work towards elimination through what are called the 3 pillars. And those are HPV vaccination, widespread cervical cancer screening, and timely follow-up and treatment, if needed, of precancerous lesions and invasive cancer. And these 90%, 70%, and 90%, those are the WHO targets for these. So why should you develop an elimination plan? If we're all on the same page, obviously, about the goal of elimination, why do we need to make a formal plan? A lot of reasons. So it's extremely important because it garners support for the initiative. It helps raise awareness about the importance of the issue. It helps to coordinate efforts. That's extremely important as well. It helps to catalyze, and this is one of the key features, it helps to catalyze and spark action, which is what you need to get started. And it unites people behind a common purpose with common objectives and goals so that everyone's on the same page, because people have a lot of ideas. We got to get them together. Here are just some examples of plans from other countries. Denmark, Ireland, and Australia, of course, they're great. Even Malaysia. And it's important for an elimination plan to be reachable and feasible so that it's realistic, as I was saying, and achievable. You don't want to set yourself up for failure. But it should also be aspirational so that there are elements further from your reach a little, so that you have something you're really striving for. And that further cements the bond of everyone who's involved in their commitment. Oh, okay, this is my favorite slide. Elimination planning just across the world. This is something I want to talk about because it is such an important point for all of us to really stop and consider. And I've done a lot of thinking about this, and it still just blows my mind. So looking at elimination planning across the world, in 2020, the WHO adopted their global strategy for cervical cancer elimination. And there are also regional plans throughout the world, such as the Pan American Health Organization, the Asia Pacific Economic Cooperation, as well as the Elimination Partnership and the Indo-Pacific for Cervical Cancer, or it's called EPIC, and that's like Fiji and other countries. And then a regional elimination strategy for the Eastern Mediterranean. There are other regional plans, and there is a long list of countries that have formalized elimination plans and national HPV vaccine programs. And these are just some of them that I've listed up here. You can read it for yourself. But just, I mean, calling some of them out, some of our counter.
Oh, no.
Was that bad? Really? I can't hold it. So, a lot of our. A lot of our countries that we consider our, brother, sister countries. So, Australia, Canada, England, Ireland, places, Scotland, places like that, but also that you might not expect, such as Nigeria and Rwanda and Sri Lanka, Tonga. And I actually kind of love Nigeria's plan because they are so realistic, and I just am there for it because their elimination year date goal is like 2086. And I'm like, yes, but you know what? At least they have a goal. Like I'm here for that. In 2023, Alabama, where I am from, introduced the first state level plan in the US. You're being very distracting. So that's so. In 2025, the HPV vaccination Southeastern Roundtable, which we've talked about and I'll talk more about, launched the first US regional call to action, which we'll discuss. And I want you just to take a second and look who's missing from this list of world leaders. That's right, us, the US, who we pride ourselves on being leaders in everything, in sports and science and medicine, and but we're not on this list. I mean, Sierra Leone, Rwanda, Samoa, we're not there. I like, that's why this slide blows me. Sweden is hoping to be the first to reach their elimination goal in 2027, and they're well on their way. And Australia was one of the first to introduce their national publicly funded HPV vaccination program, and it's on track to reach elimination by 2035. And just a more shout out to Portugal, because they met all their interim global targets by 2025, and they have a vaccination coverage that is exceeding 95% right now. So just wow. Many of you are likely familiar. Oh, sorry. Thanks. I have to set something. So, many of you are likely familiar with Alabama's state cervical cancer elimination plan. We just held our third annual statewide cervical cancer elimination summit last Friday, and we continue to make strides in raising awareness, prevention, vaccination, and expanding access to cervical cancer screening and follow-up care. The website for Wipeout, which is the name of our initiative, you can see it here. It's full of information and resources for anyone who's interested in checking it out. And several other states have asked Wipeout leaders to present about our state plan and consult and talk about it, just to kind of hear what it's about to say. Now I'm going to talk more about what Dr. Bob mentioned, which is the HPV vaccination roundtable of the Southeast, which is a mouthful. So I'll probably just the Southeastern table. You might not think of this being in the Southeast because I don't. Includes Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, Mississippi, North and South Carolinas, Tennessee, Virginia, West Virginia, Puerto Rico, and Washington, DC. So we are working together to change the story about HPV vaccination in these states and in our regional together. So what is the Southeast Roundtable? Our vision is to end HPV cancers, starting with the elimination of cervical cancer as a public health problem. Our mission statement is right here. We serve as a collaborative of people representing like-minded organizations and individuals who are committed to improving HPV vaccination coverage in the region through coordinated efforts to stimulate collective action and implementation of evidence-based interventions. And for membership, it's open to anyone who really shares our objectives and our goals. And I will put up a thing later in case anyone's interested in joining us. You guys, we'd love to have anyone who's interested to be part of it. During the 2024 Southeast Roundtable annual meeting in person, which we do every couple of years, we identified 3 action priorities for our organization. And these are the 3: communication, elimination, and started H9 other best practices. Clearly, I'm going to be talking about the elimination priority. So here it is in depth. So we're talking about, or this is what we've been focusing on, is developing and disseminating a plan for HPV cancer elimination in the Southeast, beginning with cervical cancer as a public health concern. And the underlying objectives for this were to develop a regional plan for eliminating HPV cancers, starting with cervical cancer as a public health concern. It's very long, and I objected to the length of that, but it felt comprehensiveness was important. Identifying and unifying partners in a collective voice around a plan to eliminate HPV cancer, starting with cervical cancer. I think I actually cut off the end of that. And then building a toolkit with the Southeast Roundtable states and jurisdictions to develop their own elimination plans. Oh, and my co-lead is Julia Brown. She is actually at St. Jude, and she is wonderful. So this is a truncated version of one of our deliverables. This is the elimination fact sheet, and I really encourage you to go online and check this out because it is such a nice, concise, comprehensive overview. It addresses the distinction I talked about between elimination and eradication. It addresses why the roundtable decided to focus first on eliminating cervical cancer rather than another HPV cancer. There's an overview of cervical cancer, and it talks about the WHO's global strategy. And then the fact sheet goes into a little bit about elimination planning, highlighting current efforts, and providing additional resources. And the website is at the bottom. I'll also at the end make it even easier. This is a snapshot of the full call to action that we developed. Of course, you can access the full call to action right from the landing page of our website, and we encourage you to check that out too. But this is just kind of like a bragging thing of us looking how beautiful it turned out. It's amazing because we worked very hard, including Dr. Bob, who is chair of the steering committee for the HPV Southeast Roundtable and has worked closely on the elimination as well. So one of the most significant resources that we developed as an elimination team is this toolkit that accompanies the call to action. And this has been made available by request only, but you can make a request really easily on the main site on that elimination page. And the toolkit was developed to be used alongside the call to action, and it offers really practical resources such as like templates and guides and planning tools. These practical resources were designed to assist in putting these strategies actually into action to develop and implement your own state level elimination plans. So they're not like mandatory by any means, but I always am, this is like, I love examples. So I think other people might too. As of December 31st, 2025, there had been 49 requests for access to the toolkit, and I know that number has gone up since then. So what do we decide? I mean, I know you've been in suspense, I'm sorry to interrupt. But the Southeast Roundtable identified 3 primary elimination goals to inform the development and implementation of state level plans. And these are the 3 pillars we discussed earlier, with the goal of reaching 80% coverage for each of these for HPV vaccination, screening, follow-up, diagnosis, and treatment by the year 2030. And just as a more detailed explanation of each of these pillars, we want to increase the percentage of adolescents aged 13 to 17 years, starting at age 9, where data are available across the Southeast, completing the HPV vaccination series to 80% by 2030. And for cervical cancer screening, we want to increase the percentage of people with the cervix across the Southeast who are up to date on cervical cancer screening based on the current USPSTF guidelines to 80% by 2030. And then also increase the percentage of people with the cervix across the Southeast who receive appropriate follow-up diagnosis and treatment if needed for abnormal cervical cancer screening results to 80% by 2030. And now I'm just going to briefly talk about another core element of elimination planning, and this is evaluation. So evaluation is a key component of this work to assess the effectiveness and the impact. And people find it boring, and but you have to know if it worked, if what you're doing is working. We want to know if the call, for us personally with our work, we want to know if the call to action in the toolkit achieved the outlined goals and objectives that we set out. And we want to measure the impacts and the outcomes of our work, of the resources that we sent out. Some key aspects of our evaluation include determining the reach of these resources and how they were used. We also want to know what the most utilized resources were, and first to identify the strengths and areas of refinement for future use. Another key consideration, or another key reason really for conducting evaluation in this structured way, is that it provides us with coordinated priorities and measurable targets across the region, so across all the states. So we have some level of standardization. And if you're a scientist, which maybe it's just me and Dr. Bob in here, I don't know, but that's so important. We need that standardization, and it's lacking in everything. So it's just really helpful to see, and we can compare, how is Alabama doing to Georgia, to Florida, to Puerto Rico, and see just how everything is doing. The toolkit provides resources with guides and templates and technical support actually as well for implementation and evaluation guidance. And again, we're talking about 2 different types of evaluation. So on the left, we have the type of evaluation we're doing with our call to action and toolkit, which probably is not that interesting to you, and that's but on the right, we have the state level plan or evaluation planning that we kind of suggest, or when people ask for suggestions and for examples. And that's more interesting when you're developing your own elimination plan, because people say, well, what are we supposed to measure? And these are just some examples. They are into evaluation, and it's about evaluation. They get it. So these are just some examples that can be used at the state level, and there's a handful of things. There are more examples and suggestions of state level measures provided in the call to action and the toolkit with like benchmarks and things like that. But just it will vary by state depending on your level of elimination planning. So, for example, Alabama has a fully informed plan done. But I know that Mississippi is in the process planning of working with their development team and all that about cancer organization in their state and whatnot. And so just depends. But examples are, the number of meetings that you hold, the number of individuals or the organizations that are engaged, and the number of those that are actually retained, longer than like the first meeting. The number and types of events and activities you have, website development, if you have a website, associated metrics like clicks and requests for things and visits to the landing page, and things that I'm not really familiar with, but other people are. And that's why you have moderators, requests for speaking engagements and media interviews, press releases, op-eds, progress of formalizing your elimination plan, which, you seem to get things done here. So it seems like that would be pretty quickly. And then, surveys or things like that. And why is it important to do some state level evaluation? Because it helps you as a state evaluate your own elimination plans against regional benchmarks. So if as a region, we're going for 80% for each of those 3 pillars by 2030, then you can see how you're doing, for that 80%. It also helps to ensure strategies reflect your local context, because every state's different. Every state's going to need different adjustments, because I very seriously doubt Puerto Rico is comparable to Southern Alabama, or Appalachian Tennessee, or wherever, So you're gonna have to kind of tailor it to where you are and the needs and availability of resources. So it just is going to have to be special. Make it special for you. But having some of this evaluation data and information will be really helpful also for other states, maybe who are in more of the beginning stages of planning, and as you all continue on, and even those with that are very fairly along, because you can offer ideas and share insights, what's worked, and really I've often learned the most from what hasn't worked, the lessons learned kind of thing. And I think that that's great, saying, oh man, and we developed our plan and this was fantastic, and oh, do not do this, this is a horrible disaster and failure or waste of time. So ultimately, though, state engagement is essential for us to ensure progress towards HPV cancer elimination across the Southeast. So we need all of the states in the Southeast to really work together. And this is not going to be an individual state. Honestly, and I don't think it's off the record, because this is definitely an off the record situation. I don't want to see 50 different elimination plans. I'd love to see one elimination plan as a nation. And that's why doing this as a region and really working together to identify things that we can all do and share ideas and collaborate is so important. So I think that this is a great opportunity for us as a Southeastern region to work together toward that. But don't tell anyone it's happening. So if you have any questions about the Southeast Roundtable, you can email preventhpv@stjude.org. These QR codes, this one on the left will take you to the elimination landing page, and that'll take you to all of the toolkit resources, to the call to action, to the fact sheets, to all kinds of cool stuff. And then if you want to join the HPV Vaccination Roundtable of the Southeast, which we would love to have you, you can look at this QR code on the right, and please join us. We don't ask a lot. We just want to give you some information and have people who are interested in the same things that we are, and clearly all of you are. So yes, anyone's welcome to join and come and see what we're about. This is because of the backdrop. Right, like the public shaming. Oh, I'm so excited.
Thank you. Wait, we gotta take a picture. Oh.
Gotcha.
Now get on my back.
Yeah.
Thank you so much, Dr. Daniel. I think that this is such a great call to action for all of us to hear the work that's being done, people that are in various different stages of that planning. I know here in Georgia, we're in the early stages of that planning with HPV Cancer-Free Georgia, which again is our statewide working group that's part of the Georgia Cancer Control Consortium. We're convening a subgroup on that, which I'll be leading to really pull people together so that we can start developing our Georgia statewide plan. So there's going to be a lot of interactions there. But as Dr. Daniel mentioned, again, within the Southeastern Roundtable, I'm the chair of the steering committee, and I'll never let an opportunity pass. And I knew she was going to tee that up because I had seen her slides. But those QR codes that were up there, for the membership, we don't gatekeep. We want people. We want clinicians, we want researchers, we want community advocates, we want the people that are interested in this, the people that are willing to put that work in, express that interest to join the roundtable. This is a very, very collaborative effort. It is open, and one of the things that we're trying to do, as we're formalizing membership, and again, all that information is available through those QR code links, is to really make it worthwhile for the members of the Southeast Roundtable. We're developing continuing education credit programs. We're in the process of getting all of our resources that we have developed over the years and having them available for members to be able to access, so that all this good work that's been developed over time is going to be available for all those members. So if you're interested in this, please join the Southeast Roundtable. I know Georgia's representation on it is pretty good, but we are being far exceeded by a number of other states. So this is our opportunity to really kind of step out there a little bit. So I think one of the best tools that we have to improve HPV vaccine uptake is really the hard work that our doctors, our nurses, and all of our healthcare providers do every day in their clinical encounters with patients and with parents. And it's so important to hear the perspectives of providers on the importance of vaccination. So now I'd like to introduce our clinician speaker, Dr. Tressa Chappell. Dr. Chappell is an associate professor of medical education and pediatrics at the University of Georgia and an adjunct associate professor of pediatrics within the Augusta University and University of Georgia Medical Partnership. Dr. Chappell is an educator, clinician, and advocate for vaccination.
Hey everyone, thank you so much for inviting me to speak today. So I'm originally from Jacksonville Beach, Florida, but I now proudly call myself a Georgian because I have been here since 1996, living, studying, and working, except for a brief 3-year stint in Nashville for residency at Vanderbilt. So you might be wondering, why is a pediatrician and a medical educator here to talk to you today about cervical cancer and HPV? So before I answer that, I want to ask you a few questions. So raise your hand if someone you know and love has had cancer. Now raise your hand if someone you know and love has died from cancer. And now raise your hand if you would have done anything in your power to prevent your loved one from suffering or dying from cancer. Next slide. Thank you. So I have, this is my dad, Ronald Allen, pictured with my 3 sons. And I watched him battle prostate cancer for over 20 years and ultimately die from it in June. If there had been 2 or 3 shots that he could have gotten to prevent the years of suffering, including hundreds of injections, surgery, radiation, chemotherapy, and ultimately death, he would have gotten them in a heartbeat, and I would have made him get them in a heartbeat. The good news is we do have the ability to protect our loved ones from certain cancers caused by HPV. Today, I'm here to share my experience as a physician who has sat across from parents making decisions for their children that can prevent cancer. I'm also speaking as a medical educator that gets to teach our next generation of Georgia physicians about one of the most powerful tools that we have in medicine, vaccines. And most importantly, I'm speaking as the mother of 3 teenage boys and the aunt of 2 teenage girls. So as Dr. Daniel explained, HPV is extremely common. Next slide, sorry. And most people are exposed without ever even knowing. The HPV vaccine is not just about preventing cervical cancer. That's just the tip of the iceberg, so to speak. It also is about preventing oropharyngeal, vaginal, vulvar, anal, and penile cancers. It also prevents significant morbidity caused by other HPV-related diseases. Women with untreated precancerous lesions or an HPV infection have a higher risk of preterm birth. Some of the procedures that are used to treat precancerous cervical lesions caused by HPV can also result in increased risk of pregnancy loss and preterm birth. And infants exposed to HPV during vaginal birth can develop lesions in their airway that lead to breathing problems that require repeated surgeries. The effects of HPV are not just something I've read about in textbooks. I have a family member who had precancerous cervical lesions in her late 20s and required invasive procedures. I have a family friend who was diagnosed with cervical cancer in her 30s and has endured an extraordinarily difficult journey and battle for her life. I've taken care of infants with breathing problems due to HPV lesions in their airway. I remember working as a medical student just down the street at Grady and caring for adults that were suffering from diseases that were largely preventable. I felt very frustrated and very helpless. I knew early on in my training that I wanted to prevent disease, and that's what drew me to the field of pediatrics. After years of vigorous research, the HPV vaccine became available for girls in 2006 and then approved for both boys and girls in 2009. And this just happened to be when I was completing my residency and beginning to practice here in Georgia. It was an incredibly exciting time. We now had 2 vaccines to help prevent cancer, the hepatitis B vaccine and the HPV vaccine. We know that the HPV vaccine works best when started at ages 9 to 12, as Dr. Daniel explained. And that's because this is when the immune response is the strongest, and also we're able to get the vaccine in before exposure to this virus is occurring. Early on, I can tell you these conversations about the HPV vaccine with parents of tweens were extremely challenging. No parent wanted to think about their adolescent doing anything that might result in exposure to HPV. I explained to parents that HPV exposure can occur with any intimate sexual contact beyond kissing, and it does not require intercourse. And I also know that exposure occurs not all exposure occurs during consensual contact, and that the trauma of sexual assault can be compounded by leaving someone with a virus that could cause cancer decades later. With time and strong evidence-based recommendations and approaches, these conversations became easier and much more successful. And as we've seen, the HPV vaccine rates in Georgia have improved, but we're still not where we need to be. We must do better to protect our future. And it was a very exciting day when I got to begin protecting my oldest son, who is here with me, against HPV when he turned 11. I was so excited, I took a picture, which last night he told me is really weird, but when you're a pediatrician and you're passionate about vaccines, this was a big day. And then I took my middle son, who got his vaccine at 11, and then lastly, my youngest, who actually got his vaccine at 9. Prevention saves lives. It also saves healthcare dollars, and to do this well, we must ensure that kids of Georgia have access to pediatric care and vaccines. We must ensure that all women have access to cervical cancer screening and treatment. We also need all our lawmakers and leaders to support medical experts in their evidence-based recommendations and to support and fund research to improve the detection and treatment of HPV-related diseases. So back to my original question, why am I a pediatrician talking to you about this today? As a pediatrician, I know that preventing cancer starts long before adulthood. With awareness, access, and leadership, we can make HPV-related cancers and diseases the exception, not the expectation for Georgians. Thank you so much for allowing me to share my experience today. And please remember that vaccines work, vaccines are safe, and vaccines can prevent cancer. Thank you. Come back here.
Yes, ma'am. That's another stuff. Thank you. And. Wait a minute, I got it. Thank you so much. Yeah, I'm from the South, so I love giving gifts.
Gotcha.
Thank you so much. We could go and get cleared out here.
Oh, yeah, I saw why. Working around the schedules of state legislators is always a challenge, and requires a lot of flexibility. So we're just sort of rolling with changes to our schedule. So thank you very much, Dr. Chappell, for that amazing set of context on this and why this is so important. When we hear about the importance of vaccination, we hear about it from our researchers, myself, Dr. Daniel, from our clinicians, Dr. Chappell. But sometimes that work can seem a little abstract. We can see these numbers and these percentages of vaccine coverage or goals towards elimination planning. But some of that abstraction can really come about because there's a common adage that we use in the field of vaccines that when vaccines work, nothing happens. And while fewer cases of disease is a really, really good thing, you can't count something that doesn't happen. And that makes it hard sometimes for us to be able to get that message out there about why things are so important. Because people say, well, we don't see the disease anymore, so why do we keep vaccinating against it? And that can be a really, really hard message to get out there. And it can be hard to discuss some of the impact of these diseases and why it's so important to prevent them. That's why right now I'm so honored to introduce today's survivor to hear their perspectives on the importance of preventing cervical cancer. So I'd like to introduce Jill Spence. Jill is a resilient stage 3 cervical cancer survivor from Jefferson, Georgia. She was first diagnosed with cervical cancer in January of 2023, underwent treatment through the Northeast Georgia Health System where she received comprehensive care. It's actually supported her to be able to be here to speak with us today. So I think it's so important that we hear these messages and we hear these stories about what can happen if we don't vaccinate and why this level of prevention is so important. So Jill, I'd like to turn it over to you.
Glasses off and tissue ready.
All right, so I was raised in public safety in a healthcare family. Saving others was not just encouraged, it was kind of expected of us. And unsurprisingly, I followed a career path in public safety as well. Service is just what my family does, and the background has kind of shaped who I am and is a little bit about my cancer journey. So in my mid-20s, I became a single mom of 2 young boys. I worked overnights and I picked up as many extra shifts as I possibly could, as well as adding a part-time job to ensure that everyone had their needs met. Like many working parents, especially those in public safety, I placed my own health last. There were always another shift, another bill, or another responsibility that became more urgent. In the fall of 2022, I began experiencing a heavy menstrual cycle. While concerning, it wasn't entirely new to me. I've always had an irregular cycle. But I knew I needed to establish a new OBGYN, and my mother encouraged me to make an appointment. Still, I didn't feel an immediate sense of urgency. When I finally reached out in late 2022, I encountered a familiar barrier, which was limited access. Thank you, COVID. Several offices had no availability, and the earliest appointment was in March. While frustrating, I didn't push further. At my age, I assumed it was something relatively benign, perhaps fibroids just requiring a minor procedure. I returned to focusing on work, parenting, and serving others. But on January 25th in 2023, everything changed. My foot became sensitive and began swelling. It was painful to walk. It felt like it was some sort of a sport I hadn't trained for just to function. I finally went to an urgent care, scared, but trying to be reasonable. Reasonable being that I thought I was dying of heart failure. Instead, told my hemoglobin was 6.4, bottom of one of my lungs. And fuzzy's not something that you really want to be told about one of your lungs. So I went to the ER. I was sent to the ER for blood transfusion. What followed was hours of waiting, blood work, pelvic exams, CT scans, and transfusions. Very medically thorough. So eventually I was told that I had fluid in my abdomen, 3 masses, 1 on each ovary and 1 in my cervix. I was admitted overnight, given another blood transfusion, and sent for an MRI. The next morning, a nurse asked if I could stay just a little bit longer before being discharged so I could meet with an oncologist. Not long after, the kindest, tiniest 4'0" woman walked in my room. She introduced herself as my doctor and apologized for making me wait. She did a quick exam and told me that I was on her schedule first thing in the morning and she'd already penciled me in for surgery the following week, just in case. We did a biopsy, then we waited and waited. In the meantime, I had over 1 liter of fluid drained off my abdomen. The original biopsy results were passed to another pathologist because we couldn't figure out what cells. As my surgery date crept closer and they were unclear on this cancer type, the biopsy was then sent to Harvard. And I was like, Harvard? With surgery just a day away and still no clear answers, my tiny little Labrador energy doctor, Dr. Chelsea Chandler, called me herself. She told me that clinically she couldn't find a reason or even explain, but she had an instinct that we just needed to move forward with the full hysterectomy. But she wanted me to be a part of the decision. At this time in my life, I had surviving teenagers, and I had no plans to have any more kids. So I agreed to move forward with the surgery. Soon I had a port placed. I had 6 rounds of chemotherapy, and within the first 2 treatments, my hair started to fall out. As someone who has cherished long hair their entire life, I knew that this was going to be harder than I wanted to admit. To gain back some of the control, I allowed my son's girlfriend that was in cosmetology school to use my head as a mannequin. So every few days I had a new haircut, and it was just one small deliberate step towards easing the inevitable. A fun fact that no one thinks about until they're living it is chemo doesn't just take the hair on your head. It makes your eyebrows disappear, your eyelashes vanish, your tiny little nose hairs, they're gone. And yet somehow in the middle of all that, moments of unexpected grace came when I had the smoothest legs a girl could ask for. After 6 months of Taxol, I moved to a roughly 18 rounds of Mvasi. I know how lucky I am because I only experienced hair loss, mild nausea, neuropathy, some mouth sores, and deep aching fatigue. But against my family's wishes, I continued to clean and work a few days a week. Not because I had to, but because it reminded me of who I was. And in the midst of appointments, PET scans, and infusions, I even earned a life-saving award. It wasn't bravery or denial. It was the quiet refusal to let this disease rewrite my heart. Cancer could take my hair, it could take my energy, it could take my comfort, but it would not take my compassion, my work ethic, or my sense of purpose. Now here I am. When I was asked to come here today, my first thought was, surely there is someone that has a more impressive survival story than me. Sometimes I even forget that surviving stage 3 cancer is kind of a big deal. I've been told by a few doctors who later reviewed my case, they believe if I had taken the traditional route, I wouldn't be here today. by starting just with radiation. I likely wouldn't be disease free, but the funny part is that decision wasn't based on charts or statistics. It came from a gut feeling that Dr. Chandler couldn't quite explain, and one I just decided to trust. And somehow that instinct changed everything. It turns out that every once in a while, going with your gut instead of overthinking the facts makes all the difference, and I'm living proof. Thank you for inviting me here and giving me the opportunity to share my story. I know that there are probably millions of people out there right now just living every day, living their everyday lives with no idea what the difficult decisions or a long road to recovery is ahead of them. My hope is that during those moments, they find their own Dr. Chelsea Chandler along the way. And I hope that all of you, through awareness and education, are able to help that happen by encouraging conversations, inspiring change, and reminding women in my age range and younger to listen to their bodies, ask questions, and advocate for themselves. If my story helps just one person pay attention a little bit sooner, I will get like that.
Yeah. But stand right there. I just want to say something to you. I'm glad that you're here. Yes. Yes. Well, the legislators supposed to be here. So they came in, they showed their face. But I do know that Representative Evans had a committee hearing. And she sits on the rules and judiciary. And if you know anything about that, if y'all remember the song, I'm just a bill sitting on. I don't know the rest of it, but a part of it is those hearings. And it's so important that, so I understand her. I'm gonna be honest, because I'm an open book. I'm a little disappointed in everyone else, because if you can talk the talk, if you can walk the walk and talk the talk, no, wait, if you can talk the talk, you need to walk the walk. And we need more signatures on these bills, and I'll come back and tell you all about those bills. But in the meantime, before you come back up, wait, is it my turn?
That's why I wasn't sure for just after that,
Yeah.
so I'll just
Okay.
leave it to you.
Well, real quick, the board that was falling, I just wanted to tell you all a little bit about that before I go on. But this is our abstract that Grace, hopefully she's online. Hi, Grace, if you are, that helped submit it to the IPVS, International Papillomavirus Society, and got us approved. And Dr. Baldwin, where you at? Dr. Baldwin. Help Jana and Bella helped get the information. I put it together. Dr. Baldwin cleaned it up, and this is the result. Thank God I had the opportunity to present it in Bangkok last year, 2025. And if anybody ever been to any of those conferences, it's good, but it's a lot, because I had to do Thursday night, I had to do Friday during the day, and it's a presentation on telling the same thing, and then Saturday morning, and after Saturday afternoon, the lunch, I was like, Elvis has left the building. But it was a beautiful thing. I was glad to be able to be there. That was my first time in Thailand. And I even got to see some of my friends' family, because if you know me, I'm not going anywhere without somebody knowing where I am, especially a whole nother country. I got to see Bangkok, and Queen Mother passed away while I was there. Couldn't go to the palace, but it's all good. But I got a chance to see it. It's a beautiful, the people, beautiful. But this came from Bangkok. So with that being said, let's see. Just real quickly, and I'll come back and talk about the bill. But the legislators, that's an important piece, because I feel like sometimes we're preaching to the choir. when we do these, but they're not a part of the choir. They might be a part of the congregation, but not, and they needed to hear the Dr. Daniels and Dr. Chappell and Jill. They need to hear from us. So that they're the ones that's introducing and writing the policy. So it is what it is. So.
Where they're off.
Well, Representative Evans is right across the street at 409. So, but she's amazing. I can call her up and anything that I ask for, she does it. But just like Senator Rhett and Representative Billy Mitchell. So you got a few. I don't fool with everybody. And I say I own because I'm from the South. But yeah, it's a select few that when I come down here that helps me and helps me to keep putting on things like that. But that's okay because we're gonna come back on January 28th and we're gonna walk the halls and we're gonna make sure that they get some of the information that we put out today. It was on their desk. So every representative, whether you Republican or Democrat or independent, got the information, and all the senators got the information as well. So that part we accomplished. But they didn't hear. So with that, Demetrius, did she walk in? No? Okay. So that's okay. I was looking for Demetrius. Recognition of HPV community champion. Okay. Y'all know I have a story to tell. Susan Jolley is named in honor of my best friend. And I'll come back and tell y'all a little bit more about that. But I want to tell you about this person that I've known. I'm not going to tell you how long, because if I tell you, I'm telling her age and mine. So I'm not going to say it, but a very long time. And when Susan passed away, and I think I've shared this with some people before, she called me and I'm on the phone and I'm crying. My best friend passed away, and she passed away because of cervical cancer, and I'm boo-hooing. And and I was like, dang it, if Georgia had expanded Medicaid, she could have gotten the early diagnosis and proper care. And so this person who said, didn't shed a tear, didn't skip a beat. What you need to do, this is our favorite saying, what you need to do is you need to get down there to the state capitol and get on them about expanding Medicaid. I hung up the phone on her because I was mad. Just confessed, and I'm sharing with you, and my emotions is that my best friend, one of my best friends that passed away, and she had what you need to do is go work. And so I was mad for about 24 hours, and then I realized she was right, that I needed to get down to the state capitol, to the policymakers, and get them to expand Medicaid. That's where I started, and then we started with the cervical cancer, then HPV. But she still made me mad. So, but she's been down with me from day one, and I really appreciate her, and I wanted to make sure that I honor her today. So one of our champions is here, and it's Sharon J. Hill. I'm going up.
I'm told, but she said, you got to be here.
Yeah.
She will occurs.
And wait, I didn't put the batteries in here, but the lights up.
I did not expect anything less, right? Okay, this is who she is, and yes, so when we actually met, it was years ago, and she had a television program on People TV. Yes, yes, and I ended up co-hosting with her. She had actually an agency, media agency, talent agency. Yeah, that was her.
Yeah.
But you can understand all of what is going on and where it is. So I will say thank you so very much. Yes, it has been a real journey. She's on milk. Anyway, well, what she didn't tell you was she had actually been crowned Mrs. Classy Georgia.
The merit version,
Mrs.
Mrs. Georgia,
Mrs.
and I was second runner-up to Mrs. USA.
So I actually told her after that, because that came
Yeah.
after that. It
Yeah.
came after I had already shared with her about the Medicaid expansion. Look, this is what we're working on. What you talking about? So when she came back, oh, look, I won this. I said, now you have a real platform. Get to work. Do you know who represents you? Go find out and go to them that you are wanting to help with Medicaid expansion, because that's what we need right now and have needed it. Lost that $9 million. Anyway, that's what we didn't get, right? But then I shared with her about the Equal Rights Amendment, because again, we're overlooked females. And a couple of the legislators are also working on the period tax that you have heard about. So there's more that you all have said, you have spoken, that is not just one. So we have to stand for all. And with this, I'm very proud of Mrs. Trina Arnold James for all that she has. It's what I said. This is what you need to do. And when you do what I say you need to do, this will happen. This will happen. Where she said she just came from. And no, I haven't been around, but I have been around, right? But I actually gave her the steps. And again, do what you know how to do and what must be done and get it done. So I thank all of you. You are all awesome. This is a we thing. You, me, all of us, we have to get it all done.
Yeah.
And I will end with the fact that Representative Lisa Campbell and Senator Sally Farrell do have the Equal Rights Amendment joint this time legislation. And we're on February 24th. We will be here as well, recognizing the legislative champions. Maybe that'll get them out, okay? Okay. But what we have to understand is whenever you have their time, you have to know what your issue is, and you have to be able to articulate, communicate what it means, what it will mean if they stand with you. And that's all we need to do. Hold them accountable. Remember, they're our employees. Yes, that's right. We own this house. No matter how much they say you can't do this and that. Okay? But that is my back to you. I thank you for this awesome day. Thank you. You're welcome.
Did we take a picture? No. No?
Yeah.
We did?
No, we haven't.
Oh, we haven't.
Official.
Can't remember.
We do have my earring right
Thank you, ma'am.
Love you. Thank you.
Put the batteries in there like. And take a copy because it has your name in it. Okay. We'll take it, and the last one is for Janet. Okay. It's 2 in there. Demetrius, is someone I met a couple of years ago. She works for Creating Healthy Communities, and hopefully she's online. And we have been working together. I was one of their smaller grantees. So if you want to make a donation, feel free. And just being able to, thank you, to do more things, because it takes money to do, even though we're a nonprofit organization, but traveling around the state of Georgia, going to Bangkok. And I think the IPVS is going to be in Greece this year. So I'm looking forward to that. And going to back and forth to Washington, D.C. We just had a week of action in December. And then every March, I go to the UN and testify. So the UN, the Commission on the State of Women, and it happens like for 2 weeks in the middle of March. And you get to meet global leaders and do more things. So, but Demetria's our other HPV champion, community champion, because she had, once we met, she said, Triana, I'm not gonna let you go. So, and I appreciate her so much. And I wanted to make sure, because she's one of those worker bees and often gets overlooked. And I think it's important that those that are boots on the ground, that are doing the work, get recognized as well. So give her. Okay. How many have been here before? Raise your hand. How many, besides Jana, how many times? Who back there, raise your hand? 5. 5? Okay. 3? Give me a number over here. 4? 5? Okay, so add 1 to that. That's the number of times you're gonna hear this story. And Dr. Bob. Dr. Bob is amazing, isn't he? I love Dr. Bob. We've been together with Dr. Flowers down at Grady, and he's gonna be here cheering and that too. The cervical cancer for the GC3, right? Isn't that GC3? Cervical cancer is the HPV. He does a lot. He wears a lot of hats. So. But I thank God for him and Dr. Baldwin and Nari. In fact, those that help on the committee that's here, would you please stand? Stand up, stand up, stand up. And actually, we did a wonderful flyer that we send out to that you got. Ashley, wave your hand again. And Leanne. Thank God for her as well. Leanne, you've been a while. We've been working together a while, yeah. So as you all Triana Arnold James, Susan Jolley, like I said, is named after one of my best friends, Susan, a beautiful picture there. And Susan was a worker bee, a busybody, and always put other people in front of her and put herself on the back burner. And I'm glad you mentioned Pencil Me In, because that is one of our initiatives, the Pencil Me In challenge. And basically what I challenge each and every one of you to do is to pencil yourself in. We used to give out calendars and pencils because we penciling everybody else in. If you look at your calendar, it's full of everybody else except ourselves. And one thing that we do, we put our health on the back burner. I'm a busybody as well, but Susan taught me how to take some time out for myself. So I said, you know what, I'm gonna pencil myself in. And I do it every chance I get. I'm an empty nester because my last child is out of the house. 12. I raised 12, 8 boys and 4 girls. So one of them you met here. So, but yeah, the last one, she's finishing up her 2nd year at KSU. So, so Susan and I were inseparable. If you saw her, you saw me. We've been pregnant together. Excuse me, just everything. And about 2013, she started getting sick. And the difference between Susan and I is I'm a retired veteran. She didn't qualify for the Medicaid, the regular Medicaid, not the one under the Affordable Care. And then at that time when she was diagnosed, the Affordable Care hadn't done the credit where you can get the subsidies and pay just a small amount. She didn't. So her bill would have been like $500 a month. And she was a she owned a hair salon. That's why I'm a natural blonde. And because of her. So she didn't qualify for regular, and then she couldn't afford $500 a month, after you pay your rent and mortgage and bills and things like that, just that she couldn't afford it. And so as a result of that, she fell like a lot of, over 300,000 Georgians. They fall in that gap where they don't qualify for regular Medicaid, and they can't afford the $500 under the Affordable Care Act. And so she used the emergency room, which that's what they, people that are uninsured, that's what they do. They use the emergency room. I'm pretty sure medical professionals, I'm pretty sure you all see it as healthcare. That emergency room becomes their primary care. And so as she was doing that, she was misdiagnosed. She didn't receive proper care. She didn't receive a diagnosis until one day she called me crying. And imagine seeing your best friend on the floor of the emergency room, balled up in a fetal position. And nobody is helping. So yes, I almost got arrested. That's what I do. And because they call Cobb County, because I mean, imagine if you saw that. And I couldn't take it anymore. Call after call after call. They said it was her kidney stones, it was her back, she was premenopausal, everything under the sun except cervical cancer. And it just so happened to be an oncologist there at Kennesaw Hospital, and his office was not too far from there, and he told us to come. And we went. That was a Wednesday. And by Friday, he said he didn't have a full diagnosis, but it looked like cervical cancer. And it looked like stage 4. So 5.5 months later, she passed away, January 8th. Ironically, during Cervical Cancer Awareness Month, right? Mm-hmm. January 8th, she passed away. I started the Susan Jolley Awareness Program January the 11th. And January 15th, I eulogized my best friend. So, I couldn't take it. And I said, this cannot happen. It cannot be another Susan. It should not be another Susan. So that was 11 years ago now. I decided to turn my pain into purpose. And I started from there. I started talking about Medicaid expansion. I started coming down here, beating my head up against the wall. Yeah, true statement. And traveling around the different clinics I went to. I'm sorry if everybody who's ever from the Department of Public Health, but I had to get DPH involved and say, hey, these clinics are not giving out the information. They're not. They pointed me to a poster, and I didn't go in there like I'm an avid. I'm gonna, I'm Superwoman. I just went in to ask questions to see what they were doing about the HPV vaccine and what they were doing about cervical cancer. And I was pointed to a poster. And I also got on the CDC. I complained about the CDC. You got the funds. Why is it that you're not doing more? But now we've made a little stride. We've changed. We've got Janet. We made a little progress. And so we come down here. We do this every year, the third Thursday in January. So keep in touch. And I think it's important because when I was coming down, people knew very little information about cervical cancer and HPV. Now they do. And now they say, we got you. But okay, but I need you to sign this bill. That's what I need you to do. I don't even want to take pictures with you anymore. It used to be like, come on, let's take that picture. But no, I need you to go to the clerk's office and I need you to sign on to this bill because that's what's going to make a difference. We can take all the pictures, we can talk all we want, but thing that I need I need your signature on a bill. That's what I need. And I'm not gonna take anything less. And that's why when I come down here, even Capitol Police is like this. She down here for now. Cause I don't take no for an answer. I'm a spoiled kid, so hey, you can't tell me no, and then I'm supposed to be like, okay, no, you gotta tell me why. You know, and it don't matter who you are, from the governor on down, it doesn't matter. Cervical cancer doesn't have a race. It doesn't have a party. It affects us all one way or the other. So that's what I do now. I go around the state of Georgia. I set up tabling at clinics. I come down here during session and work on the bill. I'll talk about the call to action in a minute. And I go to DC and I've testified in front of Senator Sanders' committee, the health committee, and talk with our senators I actually have a federal bill that we'll talk about in a minute. So, but that's what I do. That's me. And I'm so glad that you come. And just like I told the young lady, I started with it was just 5 of us. Well, me, Sharon, and 3 others when we started 11 years ago. And now look where we are. We have partners, we have collaborations, we have projectors, and and we make it do what it do. So I'm grateful. So some of the initiatives under the Susan Jolley Foundation is the Pencil Me In, the Cervical Cancer Day, where you are now. We get with the mayors, we paint the town teal, and they issue a proclamation, and we go out tie a ribbon. City councils people on board. We go to churches and sit down and talk to the faith community. Because don't preach to the choir. I'm gonna say you'll be surprised at how many people don't know, and then how some people have been diagnosed with cervical cancer, or they have HPV, but the stigma behind HPV, you all know that. They don't want to talk about it because of the stigma behind it, but we need to talk about it. My grandma used to say, a closed mouth don't get fed. So we need to talk about it. So those are some of the initiatives that we do, in addition to coming down here, helping to write policy, whether it's in the state or whether it's in Washington, DC, what we do. So, and that's what I'll continue to do. So for 10 years, we talked about awareness. For the next 10 years, my work plan is to talk about elimination. So from this point forward, we're going to be, in my work plan, we're going to do what we can to eliminate cervical cancer once and for all. And I'm glad what Dr. Daniels said, that elimination is not saying that the disease won't, or cervical cancer won't exist. It means getting those numbers down, getting the vaccine into the arms of young girls and young boys. So, which is a good segue into our call to action. Okay, so a couple of things. The federal bill is HR 6561, and it was sponsored by Representative Kathy Castor out of Florida, and it has the language that we need, and it's the Prevention of HPV Cancers Act. She does have signers, but we need more. So what I need you all to do is, if you don't know who represents you in the congressional level, go to HPV, not HPV, the website is not on there, but go to Google and type in my voter page, pull that up and put your information in there, and everybody that represents you is going to be on your voter registration card. So you see your congressional rep, call them up, send them an email, and say, hey, I need you to sign on to HR 6561. That's all you need to just type. I need you to sign on. They have legislative aid. They will look it up And they could do the legwork, but if you want to send it to them, you're more than welcome to. You can Google it. But we need, and like I said, it's a nonpartisan issue, so it doesn't matter if you're Republican, Democrat, Green Party, Coffee Party, Tea Party, it doesn't matter. Libertarian, Independent, it doesn't matter. We need you to sign on to this bill. And then the state bill that we have, it's HB 173. But here's the thing, y'all see where it says 7th grade? That's like 14, 15 years old. And I changed the language to 3rd or 4th grade because that's the 9, 10 years old. Since they didn't want to use the age, I changed it to the grade. Okay, so you're talking about the 7th grade. We need it at the 3rd or 4th grade. So we need them to change the language to say 3rd grade or 4th grade instead of 7th grade. Other than that, it's kind of okay. And you all can take a look at it to see if it's something else that needs to be changed. I'm open to it. But the main thing is getting the HPV vaccine listed with all the other vaccines. And it's not. Even though we're not trying to make it required just yet. But it should, if we say, or even a separate paragraph instead of the other vaccines, to have the HPV vaccine listed and say the 3rd or the 4th grade. So we need to change the language, and then we also need signers. So whoever's representing you, send them an email and say, and I challenge you all today to send your rep an email to say, hey, we need to change the language to the 3rd or 4th grade. Some upcoming things, we're gonna have Advocacy Day on January 28th. Here, there's my email address. So if you wanna come down and walk the halls of the CLOV building, feel free to let me know. And we need about 12 people to help on that day. And then we will be putting out information about HPV Awareness Day, which I think is in February. I think it's gonna be in February. And then I'm trying to get a committee hearing. Now, why is the hearing is important? Why am I saying that now, even though it hadn't been out? Because we need people to come and testify. Come and share your story. Come and sit before these senators and representatives and say, why is HPV important starting at age 9 or 3rd, 4th grade? And why, we can eliminate cervical cancer, and this is how we're going to do it. But it's going to take, I don't know who said it, but it's going to take all of us. And it's not just one person, not just one group, not just one medical thing. And the crazy part about it is these legislators are hearing from medical people, and they still don't get it. I'm just keeping it real. I know we got people online, but you know what I'm saying? If you hear from a professional that do this every day, like, duh. I look like Cardi B, right? But yeah, so we're gonna need people to sign up to come down and testify at the committee here. And I'm trying to get it before the end of March, because they're in session only 40 days, and it's usually they end the last day of session is like the end of March, 1st of April, right before Easter, Resurrection Sunday, however you celebrate that day. So those are all call to action. So what are we gonna do? We're gonna get on email. We're gonna find out. We're gonna go to my voter page first and find out who represent you, if you don't already know. And then you're gonna send them an email and tell them that this is what we need to do. So everybody down with that? Any questions for me? What time is it? It's 2:05. Oh, we finishing early. Wait a minute, I gotta hurry and call the photographer, so don't nobody leave so we can take the official step. I invited the First Lady Mark Kemp to come down and take a picture with us. So hopefully she'll come down. Governor Kemp, I believe, is still here. So he was invited, but they said that he might not be able to make it. But First Lady Mark Kemp might be able to. So a picture with him would get our picture first. So And yeah, Dr. Bob, I'm gonna turn it back over to you. Any questions? Any questions for the medical people? Oh, yes.
I have that code for you. I have a certificate and a code, so I didn't want you to have to struggle to get that. So if you want continuing education, please sign in for me, and then I have the certificate and the code for you, all right?
So if you need continuing, my students over there, y'all need continuing education credit, you can see Miss Angie right here.
So we tell them online, we'll drop the link.
Oh, and then we're dropping it online as well. So, thank you, Jen. So, thank you all. So, wait, did I close the door and question, any questions? Students, anybody?
I was just wondering what the discrepancy is about the changing it from the age to the grade, what is that?
Well, they want, they're saying the 7th grade. See, we feel like the HPV vaccine is more effective at age 9.
Yes.
So when you're age 9, that's like the 3rd or 4th grade. And so, and I think you can talk a little bit more about that, but that's when it's more effective. And so they're saying the 7th grade, which is you're about 14, 15 years old at that point, and we need to go back.
So why wouldn't they just say the age that's recommended?
They don't want to say the age. They don't want to say the age. And one of the pushbacks is if we talk about it, we're going to start talking about sex. So,
And one of the interesting things is that
can you come up here so the people online could see?
You may want to repeat the question.
someone was asking, why is there hesitancy about changing it to the age as opposed to the grade? Interestingly enough, the Tdap and the meningococcal vaccine are recommended to give at age 11. So I also am a little baffled as to why we would use 7th grade, because I have a 7th grader and he's 13, so he got it and he got his stuff in 5th grade. So yeah, that's a little strange. But the point is that the first huge hurdle is just having it lumped in with those other recommended vaccines. And even just the American Academy of Pediatrics years ago supported us putting it in the middle of those 2 other vaccines. So it's not like you need these 2 and, oh yeah, there's this other one. It's just as important. And so just that simple language change of how we presented it in the order made a big difference. And then also continuing to say, this is what your child is due for today, these 3 vaccines, not these 2 and then this optional one. So really if we can get it lumped in there, and I loved how it was in the middle in the wording, that's really important and would be super helpful. So.
Dr. Daniel, coming up. You're coming up to answer. No, sir. We have a question right here. Who happens to be a doula and where? Aren't you a doula? Yeah.
Yeah, I'm a full spectrum doula and community midwife. And I just want to know, are there any statistics that can show us in getting these vaccines earlier and things like that? Yes, there's a lot of prevention that you're showing, but are there any correlation to like PCOS, infertility? Like, what's the connection? Because personally, and like in my family, the generation that did not get any vaccination, we're fertile. We have no problems having babies. And then the generation that was introduced at 11 years old are now having trouble conceiving. And they have been diagnosed with PCOS as well.
So the question was about getting the vaccines earlier and if there's relation to infertility. No. No, I think that there are a lot of factors that are involved in a lot of it's really difficult to disentangle the different things that can be involved. And there's so many environmental factors now. There's so many different, I mean, even dietary factors and just things that we're exposed to on it compared to the generation that didn't receive certain vaccinations until a certain time. But, you know, people who are concerned about the COVID vaccine, for example, causing infertility. That was an issue with our pediatric nurses, where I am, who were worried about COVID vaccine causing infertility. My 4-year-old's living proof that it doesn't cause infertility. And, and I also got a booster while I was pregnant with him. So, I think that it has to do a lot with things that we don't necessarily understand and can't explain, but it's hard because it's coincidental, and the timing of it makes it really easy to just say that, well, hey, this happened and this happened, so it must be because of this thing. But there are a lot of other things. iPhones came out. Well, maybe it's because of iPhones, and that's why causing more infertility. I know that there's a lot more that we know about infertility in general. So it's very difficult to nail down one specific reason. But overall, I mean, as I was saying about the tens of thousands of individuals who have been studied over 20 years plus for the HPV vaccine, they haven't seen infertility issues. They haven't seen anything that has caused any kind of alarm. And there is a vaccine adverse effects reporting system that does work or has worked for years in the US, where if anyone has any concerns, they can report that to the CDC, and everything is looked into. And sorry, but a lot of people do have that concern, or a lot of people who are concerned about side effects have shared that concern. So I totally understand where you're coming from, and I'm glad you asked that, because that's something that is I think misrepresented a lot of times.
Well, as a, Puerto Rican descendant, were also sterilized, through birth control and unconsented surgery. So,
Which is horrible.
yeah. So I think that's part of what what you see in the community now, is that there's a huge distrust with the medical system, and then being told things like that, like, no, there's no record of it, but when you go to the doctor to complain, they dismiss your complaints as being something else and never putting it all together.
And I wish that, and I know some of it is a time constraint. I know some of it is, access issues and whatnot, but it's like, I wish people and healthcare professionals and everyone, and it's not necessarily healthcare professionals' fault, but because they have so many patients they have to see in such a short amount of time. But I wish we had the time to sit down and talk about it in a real conversation, because it's not fair to the patient to be brushed off with, no, just don't worry about it, like, or you wouldn't get it or something like that. That's really dismissive and unfair. And I think that people would understand, and it would also build that trust back more if you took the time to say, hey, let me explain this, or, here's what I know, here's what the science I've read says. And there's so much mistrust right now, and misinformation. I can't stress that enough. And it's something that I personally am struggling with a lot. And I know Dr. Prunas and everyone in science and healthcare is dealing with just the loud voice. The negative voices are always the loudest, and the loud voices out there that are saying, vaccines are bad, or this is not true, and you can't trust this. And there was a very humorous article written about a few days ago, a week ago, which said, and I won't tell the humorous part because, tact or something. But one of the quotes in it said, anything that makes vaccines more confusing is a real win for us. It was like from the point of a disease, like from an illness or a flu or something, a virus. And that's so 100% true. Anything that makes vaccines more confusing and more just less understandable, less trustworthy is a win for a virus or for any sort of campaign. And that's what's happening right now, is people don't know what to believe. They don't know what to trust. And that's a huge problem. So the more conversations that we can have openly, and more questions that people ask. People don't ask enough questions because they do feel like, well, I can't believe the answer.
or, that they're not gonna get a straight answer, they're just gonna brush me off. That's not a good thing. Dr. Rob has a great social media where he tries to explain things, or he does explain things and breaks it down in real person terms, and helps me sometimes understand things. Even so, I suggest everyone follow him too on social media, and keep asking questions for sure. If someone blows you off or says like, oh, then that's not good ethics. That's not a good way to behave anyway. So, but thank you.
Thinking of Puerto Rico, their numbers on the chart you showed earlier were super high. Is it because it's mandated, or have they figured out some way to get over some of those historic, concerns that people have had due to mistrust and things like that?
There's no hospitals or doctors in Puerto Rico right now, so your numbers are the way they are because there's no healthcare.
There's a lot of reporting issues.
They closed a bunch of hospitals down. So,
That survey that does the teen vaccination rates. Dr. Rob, you want to answer? Yeah, tact is difficult. I don't want to insult the CDC, so. But
Yeah, so the question you were asking about the numbers from Puerto Rico, is that about disease incidence, vaccine coverage, what, like, just so I know what to respond to?
It was the chart she showed earlier that showed the vaccine rates by area, and it was showing, and theirs were really high. It was like 67% or something, 70%. It was really high. So I just wondered if it was because it's mandated in that area for people to have that vaccine, or if they've been able to overcome the mistrust in the community. I don't know. It could be both.
Yeah, and so, and even with the Southeast Roundtable, we have representation with Puerto Rico. We work very closely with them. They're very active contributors in there. And there is a lot of community advocacy and community activism that comes about. Again, going to, what Dr. Daniel said, a thing that's been through here is having that communication and having those discussions. And I think that a lot of that on the ground activism and community engagement has really served for a lot of that. As far as the data that's presented from the CDC reports, the National Immunization Survey team, I will say when we look at smaller level, like on a national level, I think that those data are really good. When we start looking at states and territories and smaller levels, there's a lot of uncertainty in there, because you're basing maybe a state or a territory estimate on data from 200, 300, 400 kids, and extrapolating that out. And while the methods they use for that are really good, you'll see a lot of jumping around. Even the data for Georgia that was shown, and when Dr. Dana said, oh, Georgia's up above the national median right now. If you look at last year's data, we weren't, and we were only at 40%, but now it's 68 or 69%, because just the way that sampling is done, the numbers can bounce a lot. So I wouldn't be beholden to a specific number, but I would look at sort of the patterns and the trajectories over time. I would feel a little bit more comfortable with that. But that being said, I think that the work that's being done on the ground there has been really supportive of a lot of that. But to the point that was made about sort of the healthcare system and issues that arise there, there are those issues that we're running into, and those structural barriers. And that does make me worry about what's going to happen when you combine structural issues with vaccine hesitancy, with misinformation, and with all of that, and where are we going to go in the future? So.
When you see all that, but you see all that reflected too in the high rates of cervical cancer that they have, because their rates of cervical cancer are, they demonstrate what you were saying, that healthcare is an issue, their healthcare access.
But I think, in addition to the calls to action that Triana mentioned, which, are at a higher level, we're talking about policy and impacting that. The other call to action that I'll put out here, and again, this has sort of been a theme through a lot of the discussions today and the talks today, is we're all here for a reason. We're all here for a purpose. And that purpose is that we believe in this. And now this is our opportunity to go out and share that message and share that work. And when you're talking with friends and colleagues and other parents, to be willing to have that conversation. And if somebody asks a question and you don't know the answer, there are a lot of resources. We have, folks, myself at Emory and at Augusta, and we've got people all over the state. We've got these really good community outreach programs that are happening there. So there's opportunities to ask those questions in those settings. And, again, the, social media outreach that's being done, it can be hard to see where the good information is coming from. But when you can find those good sources to follow them and keep going with that. I think one of the last things that I'll say in response to something that Dr. Daniel said, when we think about how people have been sort of brushed off over time and even to worse situations, we know that there have been massive historical injustices that have been done in the name of science and medicine. I wish that we could step into a wayback machine and go back and change that. But we haven't invented time travel yet. However, we can take that and use that to do better as we move forward. And I think some of that comes even from what we in this field, what we have to say. Because if we use that trite statement of, well, vaccines are safe, just go and get them because they're safe. We know that nothing is 100% safe. We know that you could go to take a drink of water and accidentally take a breath when you're taking that drink of water and get it into your lungs and have something nothing is 100% safe, but putting it in that balance. So when we talk about an issue like infertility, for example, and I'm forgetting who mentioned this through all the talks, but the treatment for precancerous lesions, precancerous cervical lesions, can involve removing tissue from the cervix. And if you repeatedly shorten the length of the cervix, that can lead to fertility issues, that can lead to preterm birth, that can lead to all of these other issues. So having that vaccine, that actually offers some of that opportunity. So putting those risks into balance, I think is really important, much more than just saying, oh, trust us, this is safe, just go and do it. But for myself and for my colleagues, listen. Hear people when they come to you with a concern and don't brush them off, because we've done a great job at losing trust over the generations, but that doesn't mean that it has to stay that way. So that's my little soapbox to wrap up this. But again, I will say thank you to everyone for being here. For those of you online, we wish that you could have joined us here in person. Seeing the number of people that are coming here in person, we may need to start thinking about getting a bigger room for future years as we go along, which is great. I love to see that. But again, to the planning committee, to everybody who's put in so much work for this, to the people who've taken time out of their days, to our state representatives and senators that have signed on to this resolution, the more that we can get that awareness, the more that we can get that out there, the further we're going to go. But again, it all comes down to us coming together in community in this way, and taking this and then going and running with it. So again, thank you all. This is a wonderful day. This is a wonderful event. So happy to see all of you here today. And we'll be doing it again next year. So hopefully we'll be here then for that.